Biological treatments for schizophrenia. Drug treatments that come in tablet or syrup form. So, typical drugs. Typical antipsychotics were introduced in the 1950s. They include chlorpromazine. These act as dopamine antagonists, binding themselves to the dopamine receptors in the synapse in the brain to prevent them from being stimulated, which blocks their action. And this helps to reduce positive symptoms and normalizes the transmission in key areas of the brain, reducing symptoms such as hallucinations. Supportive research for typical drugs. So researchers found that it alleviated symptoms for 75% of patients diagnosed with schizophrenia. This suggests that it is highly effective. Drugs offered hope to patients with schizophrenia where previously there'd been none. Typical drugs allow patients to leave the hospital and resume their normal lives, which will assist their recovery. This increases the appropriateness of typical drugs. However, a weakness of typical drugs is that they only alleviate positive symptoms. People who suffer from negative symptoms such as speech poverty will be unresponsive to this medication. This reduces the weakness. This reduces the effectiveness of typical drugs, as they cannot treat all cases of schizophrenia. As patients with negative symptoms have to find alternative treatments, which weakens the support. Atypical drugs were introduced later on. They reduced the side effects and they typically target a range of neurotransmitters, including dopamine and serotonin. Clozapine binds to the dopamine receptors and acts on serotonin and glutamate receptors. Clozapine is more effective than typical antipsychotics and reduces depression and anxiety and as well as their cognitive functioning. Risperidone was developed because clozapine was involved in the deaths of patients. Similarly to clozapine, risperidone binds to the dopamine and serotonin receptors, but more strongly to dopamine receptors. This makes it more effective in smaller doses and there are fewer side effects. A weakness of these drugs is the mild, serious and fatal side effect. Atypical antipsychotics include mild, serious and fatal side effects associated with dizziness, agitation and sleepiness, etc. Long-term use results in lip smacking due to dopamine supersensitivity. Atypical drugs were developed to reduce side effects, but some still exist, which is a serious limitation. This reduces the overall appropriateness of both typical and atypical drugs, as they have failed to get rid of the side effects. Some side effects are irreversible, which may lead to patients stopping taking the drugs. Supportive evidence of antipsychotics, studies comparing relapse rates for antipsychotics and placebos. Lucht et al. Did a meta-analysis of 65 studies involving nearly 6,000 patients. All patients either had typical or atypical antipsychotics. Some of these patients were taken off their antipsychotics and given a placebo instead within 12 months. The findings show that 64% given the placebo had relapsed, compared with 27% who had stayed on the antipsychotics. This suggests that antipsychotics are effective in reducing symptoms and thus weakens the chances of a relapse.